Hello, this is Daniel Couch, and I'm giving my reading presentation on Easing the Adoption and Use of Electronic Health Records in Small Practices. This study focuses on the American Recovery and Reinvestment Act of 2009 and its efforts to improve the health through the use of electronic health records. This legislation recognized that smaller medical practices and those serving disadvantaged populations will need support in EMR implementation. Regional Health Information Technology Extension Centers were responsible for providing much of the support, which included technical assistance, guidance, and information on best practices. The Extension Centers were a promising concept, however, at the time of this writing, there was limited information on their effectiveness. This study attempts to gauge the usefulness of these centers and answer questions such as how can assistance programs address major barriers to health IT adoption, what is the best training to offer program staff, and how assistant programs can achieve sustainability. The American Recovery and Reinvestment Act of 2009 sought to achieve national improvements to the quality and value of healthcare through financial incentives for providers to make meaningful use of electronic health technology. Meaningful use of electronic health record technology includes electronic prescribing, information exchange, and reporting of quality measures. The law recognized the challenges this presented to smaller practices. So to help achieve widespread adoption, it established and invested a total of $643 million into a national program of regional extension centers. Smaller medical practices provide the most primary care but have the lowest rates of electronic health record adoption. The extension centers focus their efforts on primary care practices with fewer than 10 clinicians, with an additional focus on settings that serve rural and other uninsured, underinsured, and medically underserved populations. The Department of Health and Human Services funded approximately 70 centers throughout the country. In order to successfully implement new health IT technology, these practices would need help with EHR choice, implementation, workflow redesign, population health management, and use of quality improvement methods. Research for this study was conducted through discussions of experiences among individuals with practical or research experience. Information was also gathered from published articles and interviews with knowledgeable people. Researchers interviewed program leaders, reviewed websites, and published reports. In the next slide, I describe some of the challenges to implementation of electronic health records and discuss how these difficulties were managed. Extension centers use practice consultants to address isolation and provide information. These individuals were responsible for establishing one-on-one relationships and provided education, technical assistance, and other support. While the consultants had the best intentions, panel discussions revealed small practices needed further assistance in the following areas. Number 1, expertise. The program consultants had expertise in software implementation, but lacked experience in adapting workflows for using electronic health records successfully. Number 2, disruption caused by implementation. Consultants needed to do a better job of conveying the level of disruption associated with installing and using health IT, especially in practices with little or no personnel flexibility. Many practices experienced a short-term decline in revenue during implementation. Practices also needed a better understanding of the cost of ongoing maintenance of hardware or software upgrades. Number 3, practice redesign. One of the most common lessons learned is that practice redesign and quality improvement methods are integral to successful use of the full capabilities of health IT. Many programs do not plan for this in advance and only recognize the importance during or after implementation of their electronic health record. And finally, the choice of medical records. Many assistance programs were able to provide only limited support to practices related to selecting software and hardware. Many small practices lack staff with basic knowledge of selecting the appropriate system for their practice or system requirements. To be effective, extension centers need to provide expertise not only with electronic health record installation, but also on how to redesign practices so they make effective and efficient use of health IT and improve the quality of care. Also, practice consultants should provide additional training on how health IT assists in achieving our common goal of improving population health. Physicians also needed to see tangible rewards, both financially and professionally, for their efforts that fairly compensate them for providing population-based care. The expectation at the time was the American Recovery and Reinvestment Act needed to go beyond their current scale and range of activities. This required additional support from extension centers and additional financial support from the federal government and additional sources. This article was written in 2010 and gives an interesting look back at some of the struggles smaller providers were experiencing when trying to implement new health IT. The portion in the article I still think is relevant today is when researchers discuss the sustainability of the Health Information Exchange. At the time of this writing, there was a lot of apprehension about the future of the exchanges as they contemplated future business models. I feel these feelings still exist as many HIEs that are unable to achieve sustainability are consolidated with other exchanges. Thank you for listening to my presentation. I look forward to your questions and comments.